Hello, and welcome to the UCI Emergency Department Orientation. This is a first-generation project. It is a work in progress, and there will be some errors during the recording and some errors in the program itself, so please bear with us while we correct these. My name is Brian Sloan. I'm the current EMIG president at UCI, and this project was put together in cooperation with our emergency department, our EMIG group, and our leadership. So a big thank you on behalf to everyone involved. Welcome to the orientation. This will be an overview for all visiting students, clerkship students, first and second year medical students, as well as department volunteers and nursing students who need to be oriented with the department, its inner workings, and general layout. Our objectives for this session are to understand the general layout of the emergency room, where to find supplies, who to find and who you'll need to talk to, as well as how to make a great impression with the emergency department staff. This is a general overview, a general blueprint of our emergency room that we will get into in further detail. As you can see, the emergency room itself is a large square, and if you get lost, you can always go back to the outer area of the emergency room, which communicates and will help you find your way back. If you can follow the mouse, you'll see that it is one large track, and you can go through it and get back to where you're going without difficulty. This black wall here is a keycard coded door that your keycards should be able to open. Our apologies that it shows up as a wall on this map. It will be corrected in a later version. So, how do you get inside the emergency room? Well, there's two ways you can get inside. You can get inside from inside the hospital or outside. From inside the hospital, the elevators from Douglas Hospital will lead you down to the first floor where you can enter the emergency room directly. As you can see, once you leave the elevators, you can make your way down through this main entrance to either the trauma resuscitation bays or into ED 1, 2, or 3 as you need. You can also enter from the tower, taking the main tower elevators. This just drops you off on the same floor, just the opposite side from the Douglas Hospital elevators. Okay, you can also enter through the ambulance ramp, although this is not a good idea. As you can see, our ambulances in Orange County are, pretty fast, and they can hit you without warning. So please don't enter through the ambulance ramp unless you absolutely need to. You can enter through the public entrance to the emergency room. You can see that there is a large, very well lit sign saying emergency room. That is the right place. So you can go ahead and enter there through the doors and check in at the registration desk here. And they will lead you or orient you in through the door here if you get lost. That door should be unlocked while the emergency room is open, so you can head back there and get into that main hallway and get where you need to go. So, now that you're in, where do you go to actually see your patients? You'll notice that some of the doors getting into the different sides of the emergency room are locked and will not be opened by your key card. This is intentional, and it is bypassable. So if you need to get past to a different part of the emergency room, you absolutely can, and we'll go over different ways you can get through in just a moment. Before we get into that, you need to figure out exactly where you're going. Our ED is made up of 4 wings. There's ED 1, ED 2, ED 3, and the trauma base. This is a general overview of Emergency Department 1. It's made up of our highest acuity patients. You'll find that there are 12 beds, a contagious disease room, as well as 3 medical resuscitation rooms. Like I said, it's the most high acuity patients, other than the trauma patients, will come here. This is where you'll find the unit clerk to help you with paperwork, as well as the charge nurse to answer any questions that you have. This unit can be very, very busy, so please try to avoid being in here, if at all possible, if you don't need to be. Here's a picture of our nursing station in ED1. You can see that some of our nurses are here hard at work, very busy obviously, as the ER is very, very busy, as you can see in this picture. This is a typical layout of the beds in ED1. We have 12 of these beds. They're all identical. You'll find all of the supplies that you need at the bedside, including diagnostic equipment on the wall and treatment supplies in a cabinet to the side of the bed. The code for this cabinet is 5705, although at the time of you watching this orientation, it may have changed, so please check with the charge nurse or any nurse on the unit. Please also try to check the cabinets and the wall behind the bed for the supplies that you need prior to asking someone to hunt down supplies for you or going to another area to take supplies from them. The techs work very hard to maintain the level of supply at every bedside, and changing it around or asking them to take time out of their other duties to find you equipment slows down the flow of the unit. So please always make sure to check in your local area prior to going somewhere else. This is not Trauma Bay, formerly Trauma Bay A, now Medical Resuscitation E. We have 2 additional medical resuscitation bays opposite to it, F and G. This is where the extremely sick medical patients will come. You can see that it's a very similar layout to the beds in ED1, although it is somewhat more extensive. There is a dedicated crash cart in every room. Your diagnostic and suction equipment is on the wall, and documentation equipment as you need is there. This is where most of our full arrests and critical medical patients will end up. Okay, so now we talked about some of the doors being locked. Let's get into exactly how you're going to get there. To enter ED1, you'll enter these main doors from the main hallway, directly across from the trauma bays. These doors are always open, so you can always come in through these doors to enter ED1. Once you're inside ED1, you can move everywhere else. This door is a door. Our apologies that it looks like a wall in this video. However, this is a key code carded door that you will be able to enter through. Okay. Once you're in the trauma bay hallway, you'll be looking at a view somewhat like this from this door, which is also key card coded. You can get through this door to enter ED2 and ED3 once you get lost. Again, this is our main hallway, and if you get lost, just look for the trauma and resuscitation rooms to reorient you. And just try to keep in mind that they are directly adjacent to ED1, so from there you can figure out where you need to go. Okay, and again, here's a general overview. To get into ED1, enter through this keycard coded door, walk directly through these 2 open doors, and you can find yourself in ED1 and any patient that's being seen in ED1. To enter ED2, you can walk through the resident room, although make sure you don't spend too much time in there because it can get very crowded, and then that is how you access ED2. To access ED3, you can walk through this main hallway to access patients there, or come around the other side and access patients there. There are no doors here, so you'll be able to get to all of them. Additionally, to get into ED2, you can knock on the doors that are directly adjacent to the beds. These are usually closed because this is our psych ED, so please have patience if the nurses are trying to get it open for you. Okay, so the resident room. This is where you spend most of your time as a rotating med student. This is where you'll find all of the attendings as well as the residents, and you'll do your documentation and give report on your patients. Okay, is unfortunately a very small amount of room here, as well as all the computers that you'll need, so try to minimize the amount of unnecessary time that you spend in there. You can bring your backpack and clothes as lunch and leave it in there, but just make sure you keep it well out of the way. You can see one of our attendings, Dr. Rutkin, hard at work, and you can see in this picture how the resident room can definitely get very crowded, so please keep that in mind while you're working there. If you bring backpacks or lunch pails, you can leave them here on these cabinets. Okay, ED2. These are our slightly lower acuity patients, as well as our psychiatric patients and our radio room. This is an overview of ED2. We have beds 19 through 26 in ED2. Just for clarification, this bed 26 is part of ED2 and not ED1. In this room, you'll find a gyne room, bed 19, which is our gyne bed. Beds 20, 21 are psych beds, as well as usually 22, 23, 24, 25, 26, and almost everything in ED2 usually turns into a psych bed. This is our nursing station in ED2. You can see some of our staff hard at work here. So if you're disoriented and don't know where you are, if this looks familiar, you're in ED2. Okay, ED3. This is our lowest acuity part of the emergency room with our fastest turnover. Okay, you can see this is ED3. It contains beds 28 through 33. Bed 33 is just a small chair with an ophthalmoscope, so this is where you're going to go to handle any eye patients you have. You can find a supply room between rooms 29 and 30, as well as a nursing station here. This is a view from inside the nursing station of ED3 in case you lose your orientation. All right, trauma bays. We have 4 trauma bays. Each one of them has their own dedicated ultrasound machine, and we also have a dedicated CT scanner that's just right a few steps away from the bays. All right, our trauma bays are designated A, B, C, and D. starting from the furthest from the ambulance entrance, which is on this side of the map. We go in order of what the paramedics will occur, D, C, B, A. This is the door to the trauma resuscitation room from the ambulance ramp looking in. And this is a general overview of what our trauma bays look like. As you can see, they're very crowded with lots of equipment, including an ultrasound machine, ranger, several supply cabinets, and lots of overhead lights and monitoring equipment. If you're here as a medical student, please make sure you know your role on the trauma team, if you are on the trauma team, prior to involving yourself in any activities in the trauma bay. It's a very, very busy, hectic place where a lot of very hardcore medical care goes on, so unless you specifically have a role, do not interfere in the care of a trauma patient. These are the supply cabinets in the trauma rooms. This is where you'll find all of the necessary supplies to do any of the traumatic procedures, as well as some of the more basic stuff you may need to do in the rest of the ED. Only ED staff can access these cabinets. They are biometrically encoded for fingerprints, so if you need something from these cabinets, you will have to ask a staff member to get it for you. In the trauma bay, for students who are rotating on the trauma service, you'll find an IV cart. In the IV cart, you'll find ABG kits or angiocaths, as well as some other equipment for procedures that are in your scope of practice and expected of you on the trauma service. The codes for these carts is also 5705. Excuse me. This is our trauma board. When the paramedics call in with a run, the information will be put on this board about the trauma that's coming in. Time is the time that we were contacted. ETA stands for estimated time of arrival. Base is the base hospital that's working the call, which may or may not be UCI. The unit will be the paramedics who are bringing in the run. ALS, MTV, and CTV stand for the different classifications depending on the severity of the injury or medical problem. ALS is advanced life support. This is for very sick medical patients that need additional care. MTV is moderate trauma victim, and CTV is critical trauma victim. As you may or may not know, there's different criteria that go into judging a patient to which category they fall under, and that will be done under further instruction in your trauma course. The other information there can also be explained at that time. This is our dedicated CT machine. If you are rotating on the trauma service or helping move a patient into the CT scanner, this is where you'll be going. Please don't hesitate to help move the patients. Nurses put a lot of strain on their backs already, so the additional lifting help is always appreciated. Again, this is our CT room. It's very crowded in the CT reading section. Please avoid using these computers to do your notes if you're in the emergency room. Okay, now, who to find? We've got color-coded scrubs in the emergency room, which makes knowing who to talk to a lot easier. Our dark blue scrubs are the residents, light blue is the nurses, and green is the trauma techs. People in light brown scrubs are the transporters or the unit clerks. These are two of our finest nurses. These are the color scrubs that they wear. Most nurses will be in a blue shirt and blue pants, although this is an exception, as well as this blue shirt is usually the exact same as this one. So light blue shirts and pants are nurses. This is one of our trauma techs. They wear green shirts and blue bottoms. So, how to make a great impression. Working in the ER can be a very challenging, demanding place, very stressful with a lot going on at once. So always come in with a cheerful attitude and be willing to work hard for your patients and to help your colleagues. If you have any questions, please don't hesitate to contact your emergency medicine interest group leadership, and we'd be more than happy to either walk you through how to do well in the emergency room or put you in contact with one of our attending physicians who can explain it to you. We hope you've enjoyed this ED orientation. If you have any feedback on how to improve the orientation video, please contact us. We'd love to hear it. Thank you very much.